So today we are doing 22 eyes of 11 patients, all but dropless. And I have my hernia surgery at the end of the day, so that's why it's shorter. So, okay, that's good. Wish me best. Thank you. Okay, my dear, look at the light. It's the best thing to do today. Just keep turning your head this way a little. Okay. There we go. That's good. That's good. So average cornea, this is first eye, first patient. Okay. Cortical cataract. Look, can you look at the light, my dear? There you go. That's the best thing to do today. That's your only job. Bit of freezing. This bites a little bit, that one. Just bear with me. That's a bit of extra freezing. Bit of pressure, that's normal. Good.
So he already used the local, right? So now I'm going to do this. Can I get antibiotics, please? Daddy will come for antibiotics.
That's good.
This has been used, so you only use this once. And then you get rid of it. This has already been used. You can't use it once. Now that I've touched instruments he's already used, I cannot go back to the table because it's different stuff. Antibiotics are down. This is going to be at the end. So I don't need to put it on straight and drown his view of what he needs to grab. I will put these things to hydrate up. These are all been used, so we're done. We'll get rid of
So cortical cataract, if you're not comfortable with it, just stain and see enough red reflex to be able to do it safely.
Okay. So now I need this instrument, now I need this instrument. So I try to keep them placed nicely so they don't get damaged. They're still fine. They break very easy. So you
And the pupil size was reasonable enough for good size rexus. There you go. So hydrosection, necrotation, hydrodilation. So hydrosection upper nasal, rotate, and hydrodelineate.
And he's gonna use this to inject it, and this is so when we get rid of this. This always stays straight.
That's good. If you want to move the phaco machine this way a little bit so it doesn't bother you, it doesn't hit you, hold it, sure. Keep going. You locked it. Yeah, there you go. So you have more space and don't have to hit the screen. Yeah, there you go. That would be better for you. Okay, that's good. You have more space now. There you go.
And always put them back in. This one I always leave. He'll use it at the beginning, he'll use it later to move it in. Always leave it. Scissors have been used.
Top, rotate. Top, rotate it. Cortical cataract is usually very soft.
He's going to use the J one next. He might use this one to hydrate.
Most of the action is in the middle.
So then I now have time to set these up in order of what he's going to use. Okay? Then once he's done with that machine, I'm going to switch it to this one. So the blue and white tip at the end, I'm going to plug it in here, and you just have to press fake. Once he's done using this machine, there's a time that's written, okay? And we say EFX and we give them a number. And they document. Okay, it's like the laser. Exactly, yeah. He's got a GoPro. You can see the tapping, which is what I like to see.
Okay.
So now that I know,
Look at the light.
I can switch to the finger. So you take this off. You kind of make sure the cords aren't tangled so that when he does grab it, nothing falls.
Look at the light, my dear. There you go. Best thing to do today.
And I just plop it here so he knows he can just grab it. And then I press fake it. touching the camera with pieces of space. Was able to dissect. Let's see.
Good.
So he's putting off the launch roll. So he's going to get in here ready. Build it all up. So these are the building before you get rid of it.
That's the lens going in.
So then he works off, relaxes the thing, puts it in there, and then he pushes it, and sometimes he needs this one with a little like tip on the end to place it if it doesn't go in correctly. So I just put it back. So the lens has like 2 rings.
Okay, the
I
lens
pressed
is.
phaco, but it wasn't. Did you press it already, Doctor?
No, you press IA now. Yeah,
Oh,
press
okay.
IA at this stage. Press IA? No? Yeah,
Okay,
there you go.
IA now.
Yeah,
Thank
yeah,
you.
yeah, yeah.
Phaco's
Yeah, fake at the
IA,
beginning and
EFX 0.4. And then he's going to make sure he takes bubbles out, make sure there's still enough space. It's like a little vacuum, so there's all that stuff in it. And then there's that hydrator, and then there's a bag that sucks it all in. So then he does one last little rinse. Then he's going to grab his antibiotics. And then if he's got droplets, which is that little orange subfute, the minute he touches that, he's not contaminated. He will not touch those and you don't need them. And we scrub again, and we get to the next table, and he's going to scrub, and he's going to scrub again, and then prep it. Same thing, take everything off and resolve. So, this one I don't take in. This one I know you've done for sure. I kind of like spin it off, put it in here. This one might be not done yet, so I'll leave these till he's ready. So now I know, he's done. So we can go all this, put all this here. This is here, this is sharps, this is all here. And then you can't forget to, when you take these apart, you plug them back together, because if not, it'll leak.
okay, all done.
Plunger goes behind it.
Okay, so this is the second eye first patient. A bit more dense at cataract. The red reflex is not very clear, so I would use vision blue to stain. Paint it. Okay. Gonna, a little bit of pressure. This is the freezing, my dear. It just bites a little. Just bear with me.
I'm going to grab these two.
There we go.
This.
I'm gonna start
the
vision
white
blue.
end. Plug it into the
Use it
side.
twice. So use it at this stage
Can I grab all 3 there? The blue and
and
the
use it under.
prime and two.
Okay.
He hasn't done it yet.
Okay.
The local?
No, that's okay. That's fine. I need
Oh, I'm doing
to.
it right now.
Yeah.
Which one do you want first?
Blue.
What's the watch?
Always blue. That's good. Thank you. Okay, now we can see the capsule. I'm going to paint a little bit more after we dilate the pupil with visco. And now we can see the original size of the pupil and the new size of the pupil. It's just a little bit bigger. I think that's good enough. I don't need to paint.
No, take that plunger out and let them know you need anything else. Okay.
Could I get some antibiotics?
Okay. Paint a little bit on the central area here.
Yeah, to be careful, these are super.
So you put it on against the capsule and
And
just
if you have
push
time, use it at the prime is complete.
and just
Come here and you take this.
move
little
it sideways. So you're painting it.
The key doesn't increase.
Okay, and just inject some this more in the coat.
Yeah.
Didn't do much bit different. Okay, maybe slightly. Okay. So place here. Yeah. Yeah, the best is to get them out of the thing
You
and
wanna
just
put them up
yeah,
on the edge?
yeah. No, just remove them from this and just put them
Yeah, that sounds good.
here. It's going to be
Yeah, no
easier.
worries.
Yeah,
You know,
it's cleaner.
you told me they were all dropless, right?
Yeah.
But this one you have standard on it.
Yeah, but she's changed her mind. Yeah, she wanted to.
Mentioned dropless too.
Yeah, yeah,
Sure.
yeah. She is dropless.
Sorry, this for-
So now we can see the rexus clearly.
The rest is through here. The wrench will use half here. The fake will be there.
So now we can clearly see the rexus. Okay. Do you see that? That's it. Now we can see it. That's why we stained it. Okay. Because you didn't see a good red reflex. Now we can see the edge of the visualization of that. Because you need to see the red reflex to be able to do the rexus, which is this step I just did. And this one, always have it from the left eye. You just put it on the same, because it hits my elbow, yeah, elbow height.
Can we get a lens from you?
No. Coder friend, endoscopy.
So we're same thing on next week. So you get one table ready, or the other table ready, and we're about to use the first one. That's what we're just slowly getting it.
Yeah.
So I like to always have the tray, like what he said, so that he has access to it wherever he can see. And then I usually put like a long glove, paper thingy, Q-tips, and then scissors, the
Okay.
I know it sounds silly, but honestly it makes the flow.
Yeah.
And once you do it over and over, it just gets 3 times a second. And we'll do
Yeah.
this for another day.
Yeah.
So,
Yeah.
and I find it's more physically demanding because it's the hard work.
Yeah.
And then you have to start, at one point, if you have lens to fold, you'll have to go through that. Folding on for tricky. Depends on the type of lens. I mean, sometimes I got it. My favorite thing. I don't know.
Yeah.
You can get the lens. So.
Yeah, yeah.
Yeah.
Once it's done, take it out. And then do this. And then again, I put that one. These are in order of what he's going to use. I would make sure it stays level and straight. And then I always keep, I'll show you that instrument after. That's always the one I use. There's other ones that he's not clear. This one here, see it's like straight. It's not a bead, it's a straight little one. That one's called the chopper. And he'll use that. And then once he goes back, you put this on, you click IA. Yeah, that's 3. See how he grabs the chopper? That's what he's doing, he's placing it.
Okay.
And he does his thing. So this is garbage. This is garbage. I leave this one again because you usually hydrate with that again after. So I'll put that. And I'll put antibiotics. These ones I still leave because he may need to use them. I'm not aware enough to know all he might do that anymore. I'd rather just have it available for him to be dry. You can, however, once you have the IA on, you can start dismantling this one because you need to take this little rubber part off. Then you need to use the wrench. And it takes off like that. Okay. This is considered sharp. Never throw this out. All these instruments, honestly, sometimes we had an issue a while ago where we kept grabbing something and missing. So now he's no longer sterile. So I can take all of this stuff out. You can throw that all in the sharps if you want. You don't have to take it off.
And we're all done. Both eyes went great. That's good news. There we go. There we go. Just wash a little. There you go. So this is the first left eye patient number 2 today, and number 1 on my list. Received peripheroidectomy. Had preparedectomy before, glaucoma. Bit of pressure, my dear. It's just it bites a little bit. That one, that's the freezing. It bites a little bit, that one, but it's going to make you more comfortable rest of the procedure. That's good. Perfect. Excellent.
So the one that's in here, yeah, and there's a blue one that's like that.
Look at the light. Try to look at the light. There you go.
Your undercoat. And the one that's in the plastic thing goes on your,
Okay,
yeah,
so
on your,
look at the light again. There you go.
so that one always goes with that one. And usually if I put, if there's another case with it, there's a little cap that goes on because it's quite thick. But, no, like a little cover. But I usually put it on it. Yeah, that's for your lens. Yeah, I never got it. Oh, it's there, that thing.
Okay.
Yeah. So I usually put that on there, so you just put your needle through it, yeah. And then just put it in. And it's just because it's thick and it just holds your, when it goes to inject, he'll hold it anyways, but it just gives it added protection. So that one, yeah, that one goes up to that one. Yes. Yeah. But the one in the case and that one in the case, go on the lens.
Okay.
Continuous irrigation on. Continuous irrigation off.
Look at the light, my dear. Look at the light.
Is there usually, I don't want to break the lens. Right?
Huh?
I don't want to break this lens. I'm just
If you're not sure, just
Yeah,
leave it
I
for
don't
me.
know.
Okay. All right. I can take this piece out with the J-canula. There you go. So. Okay, and it's flipped. So it's flipped.
there, that's probably why I wasn't
yeah.
drawing it right.
Yeah,
Mine's
so
not
it's
going
flipped.
well.
Okay.
Okay, so downwards into it.
Yeah, it has to be matching the image. There should be an image on this side here. So let's restrict it here. There you go. have been in my room.
Thank you.
And, and yellow.
Continuous
That
irrigation
is, no,
on.
that goes on without salt. They don't usually use it, but there's a little yellow, cap with a little.
And it's supposed to be in the pack?
No, we opened it. Or it should have been opened.
Well, I don't know. If you would think it would be
It would be like dropped on the table.
UFX
I
0.7.
got it, thanks. That, yeah, and the yellow one's under your thing. You see, that's the problem with like dropping all these things because they're not in. So that is screwed on to that. And then you use your, to tighten it. And believe me, if you don't use it, the machine will tell you.
Yeah, that's it.
Yeah,
You don't have to read one.
I do.
Yeah?
I read it pretty tight, but then I have a hard time getting it out.
And then this goes on top.
Yeah, so it's a little curve to it, so sometimes if you hold your finger on it, because it's a curve to it, because there's little holes on the side.
Yeah.
Just so you're not through the holes on the side, and bring it up a little bit more, it looks like it's good. The other way, yeah, it's nice to a little bit easier through, yeah.
Okay.
And we're all done.
I'll take
Did
that.
great. That's good. Okay, there you go. Okay, gonna look at the light. This is the second right eye patient number 2 today. Number 1 on my list.
Great, thanks.
It's I think cornea. Just point toward the apex of cornea. She has glaucoma. You can see the PI here.
Can you get a lens holder after too? Thank you. Wait. Yeah.
Yeah, just because I thought they were on that order or something.
No, we don't have one.
Where you have it?
It's the case.
You have an error in your machine. Okay, so
Pierce? No?
no, so that's good.
Yeah, you should have that. Yeah, because it was in there. I can give you that. You know the little butterfly wing thing?
Yeah.
Yeah, right there.
Oh, okay. Let's keep that. Thank
Can you look at the light now? There you go.
So that thing stays in there. Because that's what we use to fold the lens. Just pointing out. One goes in this way. Snaps in. Use this thing. Unroll it. I'll put 2 strips, one inside and a kind of fill it up.
So hydrodissection, necrotation, and then hydrodilation.
This off. After use the computer's thing.
So the first error happens if you take time to fill the syringes. So, okay.
So now you just fold the lens. So this is a lens inserter. You just bring this whole thing back. This is what you use. This is it's called an O'Connell, I'm not sure.
McPherson.
McPherson,
Yeah,
So you flip this open. It's important that it doesn't flip on you because you can barely even see the lens here. So I go in, I grab the little, put it down this way, and it inside. Push down, it doesn't, you don't pull the lens. Basically, you are putting the little tail inside. Because I didn't flip it, I took it to push straight down. You have to watch you do it again after you set the full.
Okay, that's fine. Absolutely.
So he's gonna need this next. You can get rid of this. You can ask for antibiotics.
Should I get some antibiotics?
Okay.
Let's see. Is it upside down again? Or is it
No, it's good, yeah. See, slide it
You can
from...
get it under the lip on the
Don't hold from the
Slide
optic. You hold from here, so you move it on. Okay.
Just push
You
it
slide
in.
it underneath the wings.
Does the wing have to go inside that little part?
So it has to come underneath those wings.
Okay.
You start folding, and you can
Bring
move
that
this
tail forward, yeah.
forward underneath the lip, and make sure it's
Okay.
underneath the lip. Okay,
Okay.
keep it here, then fold.
Excellent. So he needs the
Good.
inserter, and then he needs the shopper, okay? Don't give him this one. Give him this, okay?
That's
With
good.
that, we go to IA.
IA.
So he's ready to rock and roll with that. We'll leave this up here. We don't need any of this. This we need. This I leave that. And now he's going to use the IA. This you have to make sure you open it.
Continue
So you
dilate.
can start up,
On.
pull it up, go back here. He's using that. So I'm going to go here and I'm going to take this part off. Because it's a sharp. And most of the time when he's done that, he likes to irrigate again with a blue tip.
Continue
So he may take it. This we call sharp. So you want to kind of keep that thing for the sharp so you can stab with it. He's not going to use the J hook, the J one. Because that's easy to get all the stuff out. And then I just do it like that. No worries. I'm going to do it a few more times today. I'm going to get new with it. Now, my goal is to not bother him that I was looking before I used to. But now he's no longer touching this. We can throw all this in sharps. This.
All done for both eyes, went great. No issues at all. So this is the first right eye of patient number 3 on my list.
You do it. You go for it. I know you can. That's really good.
Good.
Give you some freezing. This will bite a little bit, that my dear. So, yeah. It started, it stopped again. Go check it out though. iPad is there.
Hold the rocks.
I put it on that side, but it
Now you're going to go.
should be on this side,
So
no?
you're going to do this. Okay.
Yeah.
And this here. We're going to do this. Okay, we'll do that. And then all of it. Did you get the local? So you should always try to get the local first. Because that's something you can use right away regardless, right? So, put these instruments like this. Okay.
You want local?
Yes, please. Do you have your local?
That goes into the CC?
Yeah, it goes into this little one. So,
Continuous irrigation on.
Thank you.
So I like to move this stuff out like this. A little bit breathing, kind of like that's pretty good. This you tighten, you put it on.
Yeah.
So, yeah, I get it. One of these, yeah.
Continuous irrigation on.
Try to like have it so that your this and now you're pretty much up. So what we're gonna do once you're down, you start draping this. Okay? So you start with the top one and then you go up. Okay? And then you're plugging the machine, you can prime and you put this in your so ready to plug it all in. Keep the white one out. Have these in my hands to get this part. Press prime, fill it up to about 9, fill it up to 9, plug it in, and then it primes itself and then plug it back. Okay? Okay, you stay, I'm gonna go and finish this here. EFX 0.8.
Holding your breath. Looks good. Thank you.
Continuous irrigation on.
Can I get some antibiotics, please?
Continuous irrigation on.
So don't pass me anything. No, don't pass
You
me.
want to
Anything.
grab it?
I'll grab it as long as it's my reach. I grab it. That's how we injure ourselves and drop instruments. And I have long arms too. We can make it, put them to use.
You said they're all droplets, yeah?
That's what, yeah.
Yeah.
But they're not mixing it fast, so
You don't. You can mix them both. Yeah, mix them both and put them. It's gonna be mixed enough. Don't worry about it. It takes like 15, 20 minutes. You know, it's gonna start settling, but it'll be okay still. Makes it easier for yourself. So. Oh, done. Okay. Relax to the freezing. Bites a little.
Yeah, I should have done that.
And then you always make sure that you're on tight. These can walk.
Two complete. One complete.
Perfect. And then put it in. And then he'll grab it. You don't need to touch anything. You can take that plunger off and it says prime complete. Does it say it on the screen? Prime complete?
No, we didn't do that yet.
Yeah, so we
That's look at the light.
yeah.
That's good.
And then we pull the lens. Yeah, I'll show you again how to do it here. So you grab this thing, grab this, you go to pull it gently, pull it up, okay? Screw this lens all the way Turn it this way. Lift it up. Okay. Go down. You grab the tail gently. You put it in here. The tail there. And then you slowly push so it slides under the two plastic plates. Sliding under. Go there. Yeah. Now to fold the wheel like this. Okay. Then you grab the little tail back. Go over and you fold it under the lip. And you squeeze it. And
See, Rob, this thing this is for that.
oh, I never even noticed that.
Yeah,
Cool,
there you go.
alright.
So this doesn't drag anymore. So it's,
We just keep getting fancier. Right?
yeah.
This is way better than
That's Steve's discovery, by the way. It's not
Okay,
mine.
we'll give him credit then.
Yeah, I'll give him credit. Yes.
So you don't push it all the way, you just turn it
Yeah.
over, and that's it, right? So this thing's already ready. I'm gonna leave it right here, straight in the flush. And then I'm gonna put this. So I know he's done with it. Okay? Once he's on that thing, oh, yeah. This is done. This is done. Okay. That you can ask for antibiotics. Yeah. So I know for sure he's gonna be using this thing. I might use this one next. Not even with that. Yeah, she's already got the chopper again. Maybe that was straight. As long as that's straight. Okay. This we don't need. Put these in here. It's all good. And just scissors too. Okay. And then you say, hey, can I get antibiotics? Sometimes when you're busy, you just do this. Okay. Go like this. And you say, hey, Katrina, can I get antibiotics? And then she treats you like that. And then she'll give you some.
Usually we prepare the part.
Thank you.
Continuous irrigation off.
That's going to be the last one here. Just leave it here.
Okay.
Did you get the FX there, Katrina?
Yeah,
Okay, thanks.
Hey, Katrina. How are you? Good, and you? Good.
You ready?
Yep, I am.
I'll be in your room, okay?
Oh, you are.
No, I am.
Come on, come visit.
I will visit.
Just make sure they're
I'll
doing.
put you to sleep.
They're not doing anything wrong to me.
No, you're in great.
Uh-huh.
That to this.
I can put you in
So put the blue and the white
I
one.
send an answer or
Careful the wire doesn't fall down. And then
Put
plug
them
it
together?
into the, no, plug it into the little machine you got.
Slippery one.
And then you press on the monitor, IA. And then put it back down. No, leave that there, it's fine. And then he'll grab it. And then you take this thing out. He's done with that. So I leave the chopper because you never know if he needs it. He uses the irrigation for sure. He might use it. He's done with the J, that's for sure. And then just put these back. And then he's gonna do his thing. So now you can grab that yellow piece.
Yeah.
Squirrel, take that out, spin it off. And then use the wrench to take off the sharp. Go all the way down to this. And then make sure you put that in the sharps and the wrench all the way back in it. And then now you wait. He's putting the antibiotics in it. And the minute he grabs that, you can disconnect all that. Put the blue into the white one. Yep, put the blue into the white one, grab that one off. I'll grab the sharps that are here. That way.
And they're all done.
Wait till-
Okay, my friends, can keep looking at the light. There you go.
Thanks, Jeff.
Need some extra freezing. That's gonna bite. So this is the first left eye patient number 4 on my list.
It's good, right? Yeah, that was on the 10th. And the one that's always separately marked was my review on. The one that's in the blue and in the like dark blue one, it was on the 10th. Yep. The separate one goes on that one goes on the 10th. Like each day.
Anybody else? Yeah.
Oh, nucleus. Folder, get it out of the back.
The effect 2.2.
Cinder, okay. Scanned. The lens going in, my friend. Almost done here. Doing great.
When we don't use. You could put it on the
It
water.
goes on balance.
You could do it on the balance. A little like vising drops.
Yeah, you can click it onto that if you want to put it on.
The bottom.
Yeah. It'll just click down. You didn't need it. Okay. So that's what it's going to do. Okay.
Oh, done for this one. So this is the second right eye patient number 4 on my list. So brown knee for cataract +3.
here.
Good morning, my fellow.
Hello, Naomi.
Hello, Naomi. How are you doing?
Oh, I'm doing fantastic.
The good thing about seeing Naomi is that we have all this. We can get something for us. Still going. You hit the light. We're finishing up this.
Wait for the next one?
Yeah.
That sounds good. You guys stay with me.
What's that?
You guys stay with me. I'm going to break back and go.
No,
Next one,
serious.
bilateral.
Too serious. If you want to go first, you can go
You
first.
want to go now?
Yeah, you can go now. You can go now.
Okay.
Yeah. We'll help you over. I'll start heredity off. So we're
Yeah. So, how is it? How was your trip? You're not so awful on Friday. I thought you were going to stay there. No, we actually did get that. We're worried about that. It's fine. People, another thing is that.
great.
No.
Yeah, I didn't go in the room. Not my place. No, I know. Don't.
No makeup, no washing.
EFX 2.1.
The iPad, huh?
Sounded like
The iPad, I think that
it rocked so low.
music started at the same time, so that was the iPad going down. Yeah. That's okay. Did it survive? I think I need to stick it directly to the wall. To
You ended up what? A leak? Oh, shoot. Had it? Bad one. Oh, wonderful. So then I Googled that. Google told me.
Google.
Google told you, James was trying to tell me to come right back. Yeah. And Google told me, 24:48. Well, I wasn't moving, so he turned around. Because I was like, I cannot stand it. I said, oh, I can't, nothing. It was great. So I thought it would go away. And it didn't.
Were you drinking lots of fluid and stuff?
My God, yeah, caffeine, everything, like what had, like, it was the most terrible thing I've ever experienced. Okay, so long story short, yeah, came back.
Okay, we're all done for this one too. Both eyes went great. Okay.
Did you get hot? Yeah.
So this is the first right eye of patient number 5.
Here, guys, at 2.0. 2.0.
Okay, on down one to go. Okay, so this is the left second eye patient number 5. Peripheroidectomy there. Average cornea. Moderate cataract +3. Bit of pressure. This bites a little bit, that one, so bear with me.
Is he still primed that with the Endocoat?
With the heel on.
The Helon, sorry.
Yeah.
Which is this, right?
Yeah.
Look at the light, my dear. Look at the light.
Wait,
So I do it the
the
other way.
lens is
Yeah.
in
Yeah.
there, but is it? Oh, yeah, this is.
So
the-
you just push it from the tip until it comes from
Okay.
the top. But
Yeah, you see it go right on up there? Good. Perfect.
Done?
Yep.
you can bring your phaco closer. Bring the phaco
Yeah.
closer. There you go. No worries. Yeah, there you go.
Just standing there, taking up space.
Can I get some mini biotics? And switch to this when he puts it down.
That's right. I didn't know there. Maybe put that down and I flip it to the IA.
So take the and if your knuckles is just capture here and just fold it this way. Get it out to the back. Don't try to capture it inside the bag, otherwise you're gonna sometimes it's soft, very soft, can go through and you can open the capsule.
And then you tell them what the access. 2.1. Wrenches. So, where's your wrench?
Right here.
Yeah.
Take the tip off?
Yeah. So that way you're ready to just pack up and go on to the next.
Pardon?
Did you load any of those?
No, not yet. Got it. Yeah, she's with Yao. I think so.
No idea. So as soon as he puts the local, I know he's like to start disconnecting this stuff here.
Yeah, all done.
There.
Well, they're doing great.
Wow.
Yeah, those voice command. But when it's noisy in the room, it doesn't understand. A bit of a bite now. This is the freezing. It bites a little.
Make them feel like you're good there, or?
See, this is my instrument language. I put my instruments I use in the back sideways. So
Sideways is all
so all done. Yeah, the stuff I would use, I would put it back in row.
Okay.
I call it my instrument language. So this I'm done. For example, this here.
Well, I'm gonna be doing the lens
Yeah,
here.
I'll head over. Come back to this. Okay, I'm not gonna touch anything dirty though, so I'll go back to that table.
Yeah, that's okay. So I gotta move on here instead. In here.
No, not that one. No. Put that one in the corner there. Grab.
See, it's because he put it sideways.
Okay. Yeah, just leave this one. So grab that one. Put that on the ground. Like, put that on the table. I'll squirt a little bit inside and pull it slowly backwards. Yeah. No, keep pulling back. We don't want to put too much.
Okay. So keep bringing it up.
Just like a little line across that ridge. Yeah, just like that, and then another one on the opposite side.
If you put too much, you're gonna fail actually because it's gonna float the lens and you're not gonna see it well.
Okay.
So if,
Okay. Grab this thing. Make sure you retract that all the way out.
Got it?
Can you see? Yeah, perfect. Put it in. Okay, now you're gonna grab that one, then you're gonna grab. Yeah, yeah. Be very gentle though. Okay? It's not. You can't like squish it. Now, no, you're gonna go this way. Just turn your thing. No, other way. Yeah, and then put it right now to the clear first. Now you're gonna. I'll show you, and then you can do it. Okay? I won't do it all the way. This is clean, so I'm gonna pull this up a little bit. Put it right in there. And you kind of like. There's not enough of it. You want to put like a little track, okay?
Okay.
You have this. Now just put it there, and you want to slide between the two ridges. These two ridges.
Okay.
Now that it slides, you put this little part, you should put it in there a little bit. You know what I do, just fold a little bit. Okay? And then you grab this back tail.
it's a non-air
Show
bubble.
this, it goes under that right here.
Okay.
Continuous navigation on.
Just like that.
Okay.
You kind of go up a little bit, turn a little bit like that. And he needs that first, then that, and then he already has the chocolate as well. So you can grab that purple one, put it here. You can grab the little hoop one, put it in there. Grab the other one, yeah. Perfect. Grab that, throw it out. Okay. You're going to move those blue little ones over there. Put that thing next to that one, yeah. Okay. Put them separate a little bit so that we can see the thing. Put that one closer. That one next. Make sure it's pointing straight up. Okay. You can put all this stuff here because you don't need any of that. I like to keep the garbage on the table because if there's some instruments that we still need or some pieces, then that's still in there.
Okay.
Yeah, and then you're gonna want to get antibiotics.
I get some antibiotics.
And sometimes if you're busy, you can just lean it in here
Yeah.
and they'll show it up. So then you gotta look at the monitor and tell them the EFX. And say it out loud.
2.10.
Okay, EFX 2.1.
If X.
Point that upwards when you climb it. Climb it a little more. And put it on the last one. Yeah. And then you can switch to the IA device. Make sure the cord don't fall off that mirror, okay? There's little spots on the table, just twist them again.
See if look here in the see the edge of the injector. When you shove it hard into the injector, it produces that dent into the thing. So I have to lay it down in the injector and just push it in. Yeah, so if you feel the edge of this thing, you'll find a little dent on this side.
So we have to be very careful with the slide.
Yeah, so when you
Because
slide
it's
it in,
straight down.
you can't. You put it straight down, just slide it, because otherwise it's gonna put the dent. And the size of that thing is exactly the size of the wound. So if they have that dent, it gives us a hard time to get into the wound because it's exactly the size of the wound. So
So the J one you can move over. Like the J one, let's move it over here. Okay.
but it was good folding.
You'll leave that there.
Yeah, yes.
I didn't do it, Rob did it.
And
It was good folding anyway.
this one out.
Uh-huh.
We're screwed out. Take it out and screw it out. Yeah, that's why I like leaving the garbage because we put all the garbage.
Yeah, I'm gonna have to check my
No.
garbage.
Okay? And then once you're done, you can get rid of all the sharps, you can get rid of all that. And once you grab the drops, I'm gonna go set that table up. Okay?
Okay.
All done for this one. Oh, this is the right second eye patient number 6. Bit of pressure, my friend, fights a little.
Right out. Sorry? I think I got you left there. Can you get any bionics after, please?
So there's only a laxity here.
Okay, so what I do is I kind of fold it before.
Okay.
Kind of put both sides up.
And then bring it down a bit.
Yes. No. So this. I go sideways, it's a lot easier. I don't know what we're doing. So, okay, you're in, right? So you fold it like this a little bit, and then you grab this little tail, and you literally bring it under the white roller. And this is the part I was talking about, be very gentle
Yeah.
with, because if you force it, it makes a big dent. So what I do is I leave it straight down, and then I go, and this all the way back, very gentle.
It's a very deep chamber.
You'd be great, you folded it properly.
So get the pieces in the anterior chambers. It's very deep. Well, the lens power is like 18, but it's not very, very deep.
You're
It
good?
has to do with the zonal laxity he has.
You'll get the hang of it.
What's that?
You'll get the hang of it. Where are we at? Where are we at?
So we're gonna move the pieces into the anterior chamber and do the stuff in the anterior chamber. Try to avoid using stuff in the bag. Okay.
No, I don't know, like, I think I'm supposed to check in with Yao in Jordan.
That's a good idea.
Yeah.
Just go scrub it.
What's that?
The more practice you have, the more
Yeah.
Okay. Put the
Yeah.
video goes out. Flip it.
I've been liking doing the knees. I've been fine.
get more involved.
It's a tone, but I feel like absolute tone. Like I'm all by myself. I can set up tone. But yeah, I can't hear what she says.
She's a lumber.
And I told her, I said, can you please
2.1.
speak up? And she's like, well, now I feel like I'm shouting. And I was like, I still can't hear you.
Could we do the next one solo on the one eye, and I'll do the other table?
Yeah, sure.
You can do the other one that's not first.
Okay.
Okay?
So I'll do the right.
Give me my first set.
So there's a little tail sticking up, I think.
See, the front haptic is here.
He's not in.
I know that now.
He's gonna refold it.
Yeah.
We'll just spray it for it, or?
The front haptic has to be kicked forward, otherwise it's gonna get caught in the. When you fold it, you close it, it's gonna get full.
So the front little tail needs to make sure it goes in that little hole. If it doesn't go in, it'll slide. I would say so. Yeah, I put as little as I can.
So when you put it in here, see what I'm gonna do? I'm gonna just slide it and lay it here and then push it, so that this way it doesn't hurt the tip.
Continuous irrigation on.
So this is on. Is it here? They won't never know. They might just chunk the line and have to get rid of, so I just leave it in. So you can line this way.
I don't go IA behind. I just irrigate. So whatever is there, you can wash it out with the safe irrigation rather than risky IA. And we're all done. Use some extra freezing, it's gonna bite a little bit. This is right first patient number 7. It's +4 nuclear cataract in this right eye. Can you look at the light? Look at the light. Here you go. That's the best thing to do today.
urination on.
I don't know where it is. I don't know if
Is that gonna be your basket? It might be in the garbage can. Get a desk open up. Yeah.
Can I get some local and,
Give me another wrench.
I left it in the.
Give another wrench in there.
We should.
Okay, thanks. Like we have it, we just, thank you.
I'll just put one in the, so they realize the pill pack.
Yeah, if you keep the peel back on the side, I'll put it back in there.
Is it in here?
Yeah.
I'm just gonna leave it in, so I'll put it like in here. So they realize the pill pack. Yeah.
Continuous urination on.
So it's about half the CC.
Okay.
And the CC is the other.
EFX 2.3.
Thank you.
IA.
Oh, that one was full. Perfect.
Yeah, not bad at all.
Continuous urination on.
The chopper.
And then what we're gonna do is we're going to do all this over here. And then you'll line up the style basket.
That's what I was thinking.
That's what he's asking us to do.
Okay.
But not all the instruments go there. There's one that has a little ball at the tip. We don't put that one there.
Which one?
The little handle has has a little bead at the end.
It's called the Lester hook.
Lester.
So there's a chopper and there's a
The
Lester.
chopper has a
It's longer tip.
so keep that one, don't put that one. Okay? What you're gonna want to do is, okay, look at me. Purple. And then you're gonna do the big horseshoe looking line. In order.
Purple horseshoe,
Yeah, put it at the end, starting on the right, working your way down.
starting at the right.
Starting on the right. So you're gonna treat this way. You're gonna want to come back.
Now, one table you have to put up right on the other way.
The freezing bites a little.
Could you press prime tuning again?
No prime tuning, no. It's finished prime tuning, right?
It's good. Yeah. 100%. Prime low bottle with height error.
And that's old, is it gray or blue?
It's gray.
Gray is an old one, it's not, so not.
Get rid of it. Just check mark it. If it's blue, you won't be able to do anything until you address the problem.
Yeah.
So give me this one. This is the next one. This one.
Look at the light.
And this is preloading. And we put that right in.
I'm so, I'm in some cases like this.
Depends if the patient is paying for
Okay,
it.
that's
It's a
fine.
different type of lens that gets prescribed. We have our conversation in the office before we
Yeah.
go.
Okay.
It's prearranged on that.
Okay.
So you should take that little low part out every time it's done. So that it
Okay.
And then you're tucking those wires through that little
Yeah.
hook, okay?
Just keeps falling out.
And the minute he's done with
Yeah.
this, I'm going to switch to that and do eye air.
No, it's not done.
Maybe you can put your hand behind.
Show me,
so you're not-
give me the cap.
No worries.
Did you throw the cap away? Where's the cap? Oh no, here you go.
Ready?
Oh, yeah,
Time
okay.
period.
So it probably didn't finish?
Well, it's at 100% on both.
I'm not sure what was the problem at that time. It was the diathermy? I'm not sure. Why is the diathermy on?
Maybe on paper.
Maybe it was in just the setting diathermy.
So it wasn't under.
I thought it was on paper.
Yeah.
Yeah. Yeah, it does. Why is it going to diathermy?
There you go. Weird.
No, my beam just should
Maybe
pressed
it's
on
like
the should pressed on the diathermy by mistake. It was primed, but not on the correct setting. This is the wrong thing. This need a Lester, I mean a chopper.
looking for the chopper. Where's the chopper?
It would be the other long one.
Probably. Well, there's a Lester and.
It won't be there. No. Debbie?
Oh, it's all the way rolled in.
Yeah. Okay.
Yeah, we
No,
got it.
there was a chopper missing. Okay.
See how look at his front there? Rolled in.
Yeah, I've seen that.
Continuous irrigation off.
2.4 AFX. Yeah.
I'm like, wow, it's multi-purpose. You take
Look at the light. Look at the light. There you go. Almost done here, by the way. So, yeah. Presque fini.
That's such a busy month next month because first week's investigation for 5 days, second week being the boys' trauma test, and the last week is spends the money next month. Yeah, I think it's too much.
Continuous irrigation off.
All done. That was the dropless. Okay. Need some extra freezing here, my friend. That's gonna bite a little bit. That one. Just bear with me. So he had serious anemia related to, I think it's the peripheroidectomy that he did years ago. Use a Malyugin ring to open it. Okay. Look at the lights. Keep looking at the lights. Here.
Because he's got a really, see, he's putting it in right now. So he uses the little instrument to like retract the pupil. So he's trying to just get it there. So he's using that.
Need anybody else from you? Thanks.
Right? It's really easy.
Yeah, no.
Now we can do surgery.
It's the same, there's also something else called virus hooks that are similar ideas that we use.
So I put on top of the Malyugin ring. Okay, that's good.
Do you need the O'Connor to remove the
I need the injector to remove it. The same tools. Same tools.
Same tools to put in as same tools to
Yeah,
put out.
exactly. Yeah. Yeah.
Yeah, at the end of the ring.
Yeah. Look at the light, my friend, huh?
Yeah, that's local. But 1.1. I got one or so.
Look at the light. Look at the light. There you go. Just that way you need to look throughout the surgery. So.
So, here you guys are bring
Yeah.
So we want to do purple, or shoot, no, purple blue, or shoot. Move a little bit on the side. Move that one to there. Move this one back in. Put your other face down. Over there. EFX 1.3. There's a purple on the other side of the yellow blade.
Purple?
Yeah, and then on the other side of the blade, and the yellow blade on the other side.
This here?
Yeah, on the other side of the yellow blade. Yeah, exactly. Perfect.
So the lens coming in, my friend, are doing great. Everything's going well.
Oh, thanks, Laura.
Take one. Malyugin bring out. Let's remove this one first. Did this here. And drag this here.
Here's a lens, yeah. The cataract with the lens in, but that little thing is just people didn't buy it. So you need to have it, so that little thing, it's just kind of like a
You don't even need the other one to get out.
Pardon? Yes.
You don't need these things for it, just
No, I'm done with it. Yeah.
Okay, excellent.
So I need to take it out with the instrument that they will plug in.
Put it in, you use the O'Connor.
No, the Leicester
The
for
Leicester.
both of them.
Okay.
So in and out, both the Leicester.
Okay.
He does do other things sometimes.
Okay.
And sometimes when I want patients to come in and out on that,
Yeah.
but often he does the two together. But he has done like, the other procedures.
And they're all done for this one. And down one to go.
What is the time? And then we'll try it.
Keep looking at the light. That's the only job today. Remember that, huh? There you go. Give you some extra freezing. It bites a bit. That's normal.
Use enough water?
This is the
You have the wrong-
this doesn't
wrong
go
tip on it.
go to the other one.
So this one goes on here,
Look at the light.
here, hold on, and refill.
So again, he has
Well, you
posterior
use it
sanica,
to-
small
yeah.
pupil. I think it's related to an old preferredectomy he had.
Take this off.
No, 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 no.
Okay.
So now you can take it off. Yep. And then you're going to press prime and tune again. And then you just press prime.
So when the pupil is that small, sometimes it's very difficult to try to attempt to put the scroll superior and inferior scrolls right away.
What's that?
So what I do, I engage the nasal one and just leave the rest of them.
Okay.
Engage the subincisional
Can I
one.
get some antibiotics,
After.
please?
There you go. So this is the second most difficult, and then the superior one is the third most difficult, and the inferior one is the easiest one. Okay. So that's the inferior one. That's good.
I thought you said I'm supposed to do this.
No, you can do it all.
Okay.
You have to wait for it to cool down.
Yes, gotcha, gotcha.
And then you're going to bring that table closer to him, lower it to the same level just a further enough so his elbow doesn't hit it. Pull that up so you can use it if you don't want to. So for sure he's going to do it next. Yeah. And then after, you can use that for sure I can do it shopping today.
I need a blue one. It punctures this side.
Yeah, I just don't know, I said trying to go down fast, and run it down. Just call it, I forget. Okay, thank you.
Thank you.
So you gotta be careful when you slide that thing on. You can just shove it on, you have to go slowly, and then make sure the tip goes over the end, and just keep screwing it down. Because if you pierce it, it just goes on and doesn't do what it's supposed to do. The yellow ones, what was the color before?
Purple.
Those ones were nice.
Yeah, the blue ones, I don't like the purple,
Yeah.
but it's a little thicker.
The
I
yellow
like
is
the yellow, they're
thin.
real thin.
So yeah, this is where he like chops it all up and stuffs it in, okay? And he irrigates it with yoga. Okay? So you use this one after. And then he'll be at this point where he's gonna wanna put that in. And he'll probably take this after. And then this. The only reason why I know is because I did this all often enough. Years ago. Repetition.
Yeah.
Choose to
I
be in
just-
there.
The thing is like, this speech is so quick, you don't have time to watch and see what it is.
You don't need to watch.
even know
You
what
just
it
need to.
is.
You don't even worry about waiting for it. You don't have time to cover it.
Okay.
So what we'll do on the next page is raise it and go up together.
Okay.
Okay?
The biggest thing that's like grinding my gears right now is I don't remember what tip goes to what side. So what I do is I have put the tray on the table because I just look at this hat, whatever sheet goes on the table, I'm like, okay, these must go together. Then I open this and I'm like,
The
whatever's
way
in
I
here
work
must go
at it
together.
is I go in order of what he's doing.
That's what they should do.
I know, but I
So
don't know
the
that right
first
now.
thing he's gonna do is
I
he's
didn't
gonna
try
grab
getting on a computer yet.
Yeah,
He's
yeah,
gonna
yeah.
grab that paper with the knife, and he's gonna grab it.
If I go
Once I'm doing that, I get the phaco dye. You get the hydration right away, so you have to do it. So you can change it now. You gotta see the effect.
Okay, well, I guess I'll for a lot longer.
So,
I don't think I
Yeah,
worked
am
that
I
much.
hitting that first, or
Yeah.
changing this,
Change it
hitting
then.
that, then saying the
One
EFX?
day-
You can say
Maybe, I
EFX
don't
out
know.
loud right now if you want.
Oh, the EFX is 2.3.
Thank you.
Make sure your tubing isn't knotted in the gray one. Because then you won't be able to. You don't have to unplug it, you can just knot the gray one. And then press IA. Okay, that's it. And then you can use this one out of the way, because you may not need it again. You will use this one again. He already is putting the lens in now. He might use a chopper.
No, Lester. Lester because of the ring. The ring is, I like to economize, so I'm going to take use the Lester to remove the ring. So you want us to use the Lester.
So you know he's gonna need
Bit
this.
of pressure, sorry about that.
This we can get rid of. This will leave in place. I'm gonna use that next. He's actually gonna use that. And then we need this. This is done. That's what he's gonna use next. Here. Not gonna use this. You go there. Just repetition. This we know is done. This is very glad. Lower this in pieces. Spread the eye. Okay. Have to retract it. Think of it as a tonsil. Okay. Always do this.
Okay.
You never know who'll go last. Even if they're gonna go. I like to do it. Sometimes you don't want to force it. No, we're going to do that one at a time.
And we're all done. Both eyes went great.
Like that. Okay? Once it tells you it's done, you can look.
So this is Rice Price Eye, patient number 8. 9, no, not 8.
There you go. Now you can see that little tiny marking off of it.
With the pressure, this is the freezing.
That's why I never throw anything off because he used it again. Right? This is done, we know that. He's used this to then say, can you get some antibiotics, please?
Oh, see, I have that tape in this one. It's 'cause there's two.
We don't need any of these because it's a foldable, it's self-foldable.
I thought I had.
And then what you can do is you can start bringing stuff a little bit closer, like this.
No, I said, I thought I had used this. I said I would usually I pull off this,
Okay, then you grab this. Put it in, just put it in good confidence. And then you do
I don't know why.
this, you squirt out a little bit. You grab here, there's a little hole here. You fill it up till it bubbles. You squeeze in. No bubbles. And then you leave it like this. Okay? He's not going to use this again, he might. You just do that. So then when he's done with that, you switch it. You're on your own, I'm re-scrubbing, I'm going to do the other two together. Okay? Now you're done with that. Something I'm just gonna leave it alone. No idea who he was at the time. One of my older cousins. Kind of rough. Right? You probably could take on. Those are Dixie chairs when you're young.
Oh, yeah?
You were, you can yell at the EFX.
So the EFX is 0.6.
Thank you.
You can switch it to the IA. You can also unscrew that yellow part.
Okay.
Good logo for me and Jen. Two people, thank you. Take this. Who's the present? Thank you. You're over two. We're gonna go line together. Yeah, let's save some time. Yeah. Thank you for us. Unless Maggie is going.
Come on, Megan,
No, it's okay.
I'll explain to you the steps, the next eye. I'll walk you through the every step, okay?
Okay.
And all done. So let's start with this. So the incision is 2.7 millimeters. It's self-sealing incision, so the length of it should be about 2 millimeters at least. So, and depending on the thickness of the cornea, I adjusted. That's why I reviewed the thickness of the cornea before I start. So he has a thinner cornea. I aim more toward the apex of the cornea to be able to achieve that length. Okay. This is xylocaine preservative-free. Look at the light, my friend. Look at the light. Okay. This is freezing. It bites.
So they don't really feel that first initial.
It's already frozen with the gel we put ahead of time, so it's already frozen. Yeah. And there's an extra freezing inside, and then this is the endocoat. It's a thicker one, so it covers well things. So it's will cover the inside or the outside of the cornea. So that's why you don't need to squirt the cornea. Other surgeons, sometimes the nurse has to stand and just keep putting fluid on the cornea so it's not to dry out. So this way we don't have to do that. And okay, this is the second incision. It's 0.9 millimeter. It's a very small, just to allow the chopper to go in. So this is the mark. You want to make sure it's appropriate size, because I want the rexus to cover the optic of the lens. So if it doesn't cover it well, it will lead to opacification. If it's too small, it's going to lead to scarring, so, and centration problems. So for us to be reproducible like that, it's you have to standardize everything. So that's why I measure the rexus. Okay, well, this is one of the most critical steps of the surgery. Based on this, the results will depend on that. Okay, and now we're going to split the layers of the lens. So I do what's called hydrodissection. You can lift up a little bit and inject this way. See the wave that went in the back here? So this is the hydrodissection. I do it in 2 spots here. And then I rotate the nucleus. Okay, so it's free to move around when I do the phaco. And then hydrodelineate, which is splitting the nucleus from the rest of it. So that's okay. So now we do the phaco. The phaco vibrates the tip. The metal tip vibrates, and the sleeve allows fluid to go in, and the tip of the metal one has a hole, so it sucks out the debris. See the.
Yeah.
So I impale the nucleus. This is called a chopper. So because it chops this way here, it's a chopping technique. See, divided the nucleus into halves, and then I rotate. Divide again and just eat that quadrant that became loose. Okay. So capsule is king. We have to protect the capsule at all costs. So I split, and all the maneuvers are happening in the middle of the pupil, away from the capsule. So it's away the iris, so we don't injure anything. Okay? Now we moved another piece. Eat it. That's good. And then the last quadrant. Okay. So now the nucleus is gone. That's the harder one. Now the epinucleus, I'm going to move it and get it out of the bag and deal with it outside the bag. Capsule bag. See here, I flip it. It's softer one. It's easy. You notice I'm not using much of phaco. You don't hear the machine going. Okay. Just a little bit to break up the plugs. Now see what my chopper is behind the phaco to protect the capsule, so I don't want to capture the capsule. Capturing the capsule is a major complication. Okay, done. Now with the J cannula, I'm going to clean up the capsule. Instead of aspirating, and just irrigate. Okay, so when you irrigate, aspirate, you can aspirate the wrong things and can open the capsule, resulting in complication. Again, capsule is king. So this way, you're irrigating, you're just washing everything out.
Yeah.
Yeah. That's good. Okay. And then I'm going to inflate the capsule. This capsule will hold the new lens, so I'm going to inflate it. Okay. Now this open, I can put the implant lens and position it properly. So I let it go and then position it with the tip. Okay, so the lens is going to open inside here. You can see that the edge of the rhexis is larger than the optic, so it sandwiched the lens well. And you don't have any gaps around it, because that gap will let cells from the anterior capsule to grow in the back, and you end up with a opacification of the capsule behind the lens. We cleaned it with laser, but if you avoid it, it'll be better. Okay. And now the lens is in good position. I just look at the light. Look at the light. Okay. Okay. Just make sure that there's nothing else hiding. And I had amoxyhydrate. This is amoxifloxacin. I'll close the wound using an antibiotic, so it's waiting for sealing the wound, and at the same time putting this humongous amount of antibiotic at the entry point of any bacteria. So this is very protective.
Yeah.
And then I'll do the dropless. So it's a mix of antibiotic and steroid and freezing. I put it right in the bottom there. Okay. So this way, patients, they don't need to use the drops for a period of time after. So
Okay.
otherwise, they have to use it for 5 weeks.
Oh,
This is a
okay.
replacement. So this is the left first eye patient number 10. That's very thin cornea, 497. So point toward the apex. There you go. Nice.
Can I get some antibiotics, please?
Sure. Okay, Dr. Youssef, Malyugin is done with his gallbladder. They have a colonoscopy to do in the room,
Uh-huh.
and then you're up. So it shouldn't be much longer.
Uh-huh, okay.
You won't even have time to think about it.
I can't run.
good, man. Purple horseshoe. Looks good. And then with your tips on, you're all ready. Great. EFX 3.5.
Look at the light. The three, keep looking at the light. That's very, very important. Okay, keep looking at the light. Doing great. Everything's going well. So just gonna clean up. They are. Yeah, they were. Wasn't it DC Boo?
Deb?
What?
Wasn't it DC Boo?
It was, but you're using a ZZBoo.
Oh, the DC Boo. Okay. 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 Yeah.
You checked it, though.
Yeah, I did. Yeah.
Your next one is,
Okay. Look at the light. Almost done. Closing down. Almost done. You did great. Everything went well. So. And we're all done. One down, one to go. There you go. So this is the right second eye, patient number 10. The thin cornea, 500. Point to the apex of the cornea.
Now, those two.
Bit of extra freezing.
The green one, the little one, yeah, we don't need that. Just straighten up. Leave that down. Okay. Take your plunger out and ask for antibiotic. You just use it.
Okay. Can I get some antibiotics?
Okay, so now you can take the condoms and not hold them. Turn it around so that he doesn't go look. Turn the handle around. Facing you. Yeah, and then bring it down. Push it down.
Bring it closer.
And that's good. That's good, right? Okay, so now what you're gonna do is, yeah, get rid of that. Get rid of all of those except the one thin one. Yeah, that one. You're gonna leave that one there. Yeah, put the rest away. Just drop them for now. We'll replace them after. because
Shell
you just
chamber.
put your syringes there for him. Yeah. Okay, now bring your antibiotic all the way over here. This is the last one we're gonna use. Okay. You can get rid of the Q-tip tips and all those. Yeah, get rid of all that. Throw your garbage in there. Put that in there. The blue forceps he's done with. You can put those away. So place all your instruments properly now that you have time. Okay, the blue helon, he doesn't need that yet. Just move it over here. We'll do some laser. Bring the chopper closer. Yeah. Now what you're gonna do is grab that one. Okay, and then in the little hole there you're gonna fill it up.
Oh, yeah.
Okay. No, don't shove it all the way in. Just reach it. Just reach it. Okay, good. Okay, now what you're gonna do is you're gonna put that right next to there. And then you're gonna put that one in front of it. Yeah. Now move the blue one over a little bit. Perfect. Okay. That's it for now. Put your braid on there. You want to cut this up? One step closer than last time. Look at that. I'm not even stressed.
Well, you're still telling me everything.
You gotta learn.
But
So you can take your wrench out of there because you need that. And when you turn it, you Phaco, and then you push it out, and then you have the EFX. So we know that once he's done with the Phaco, chopping, he's going to use the J. He's going to flush it out, right?
yeah.
Then once he's done with that, you can move the blue one actually over onto the other side. Yeah. Move the DA, that's not. Move it. Divide it with it. Put your hand. He's going to do J, right? Then he's going to put that on the helon pro. And then he's going to put the lens in. And then he's going to use the IA. The IA, right? Get through all the bubbles. And then he's going to use the blue again. And then he's going to use the only reason why I know is because we did for a while I think we worked for that.
Then I said, well, I'm going to set the table. Oh, we could do that.
Now we
EFX 2.7.
don't put his elbow in. Put it through the tube. There you go. And then you can press IA once you unlock it. Push that roll cut off, use your wrench, turn it off, and then leave on the table to take it out. Okay, now so what you're gonna do is get rid of that one. Get that one out of the way. Bring that one closer. Leave that one up with it. You can grab that.
Keep your hands down, keep your hands down. Keep your hands down, and this area is sterile, huh? It's gonna be a couple minutes and you can do that yourself later. Okay.
You can throw the inserter. Just leave one Q-tip. And just leave one piece of reason. You can throw those out. You can throw the inserter out. In the garbage. It's not bad. Grab your helons and just point them towards the camera. And then put the other one up. Just in case you want to change it. And there you go. You got it. We're almost done.
Okay.
Leave that one there. You may use it again. Excellent. You got it. Learn from my mistakes. So prevent you. Because I was notorious just getting rid of stuff.
Oh.
Because I'm so used to cleaning out, right?
Yeah,
You have to realize that some things can be used for more than one.
yeah.
Yeah, I like to reuse instruments.
Pardon me?
Multi-purpose instruments, so
Yeah,
you
you're
can use
using your,
yeah,
flush of new
yeah,
and
everything you use it multiple times, so
sometimes you'll run out of antibiotics.
efficiency, yeah.
You can get rid of everything now that he touched it.
Yeah. Anyway, oh, done, both ways went great. Okay, so. That's the cornea. Small pupil. It's gonna move, sorry about that.
Yeah.
Okay, there you go. I'll give you some freezing, my friend. It's gonna bite a little bit, that one. Just keep looking at the light. Seems to be IFS. Okay, that's IFS. It dilated more than the first time, but don't be deceived even if it dilates more, because it will close down after you start fake-owing. So the Malyugin ring, go inside, out, upside down. Tilt down so I capture these two. And this one I'll leave it in the wound. It's a very crooked luster. Serves the purpose. Add more viscoelastic, especially above the ring, so it doesn't keep flopping around.
Can you get any more? Thank you. That's not the chopper.
That's not chopper? Okay, yeah. Thank you.
You're getting it.
Can open lens.
I was gonna go try a number in the machine to see what worked, but the bubble
Well, at one point there was like five trays out there. EFX 3.1.
Keep looking at the light. Look at the light. There you go. Just keep looking at the light. Doing great.
You want chopper to insert or the other one?
I'll use the chopper and then switch to the one won't fold well.
Sounds good.
It's a little crooked.
Yeah, it is.
Yeah. That's the Lester.
Chopper.
The chop.
Oh, the Lester is the-
Use the Lester to take out the ring. I'd like to implant the lens first. So take the ring out. This one first. And this one. So then there's drag the inferior one.
Continuous irrigation on. Continuous irrigation on.
You can see the IFS.
So that one will move. Move the other one next to the circle.
Nice and circle.
Yeah, and then move that one.
Yeah, we're all done for this one.
Yeah, grab that.
So this is the second left eye of patient number 11.
Put that down.
And
Put it like where
so
you're
dense cataract and small pupil.
Now the one with
IFS.
the little bead on it. closest
We use
to
the
you.
Malyugin
Put
on
that
the
with
first
that.
eye. And here we'll do some Malyugin and vision blur.
Yeah, right there. And then put that one right next to it. He's gonna help himself.
Give you
Now
some-
put the top
Give you
off.
some extra freezing. This will bite along.
Screw it under there.
So it's IFS, but
Kind of very slow
don't be
moving.
see if it's dilated. You have to dilate it manually with a Malyugin ring.
Perfect hit. Now just put it down right there. Yeah, it's fine. The local he used, so you can grab that after anybody else.
Can I get,
Don't take the top off, just unplunge it and you can dump it. Save yourself that size.
So you'll do painting
I'll
after
put that all the way on this one.
I put the Malyugin ring. Okay. Again, it just brings everything closer here. So,
Perfect. Now move the Viking model out of the way. Move the key on out of the way. Don't move that.
so now you're gonna go
Move that over.
upside down.
Okay.
No, I'll use it. I use it again, huh?
Oh, you need it again? Can you put the
Yeah,
key
for
on?
Malyugin, I use it again. So capture the nasal, engage the sphere inferior, leave this in the wound.
I'll put the scissors away.
Lester. Lester. This is Lester.
No, plus.
It's
Yeah,
Lester. Yes,
that's
Lester. Yeah.
proper. You get the condom off after. And make sure you put your tubing inside that tray a little bit. Pull it right up. Yeah.
I don't know why it feels like I'm gonna take the yellow thing off.
You need the. Here, don't take anything. Just keep everything here for a second.
Yeah.
Okay. Any difficult case, just leave them in here. So.
Just leave. Just leave. It's fine. I don't know if it's gonna leave you alone.
اللهم سهل ولا شاء سهل. اللهم سهل.
So he's about to probably take the just doing all that stuff. So now the camera is setting in. If you can move the blue one, the blue fluorescent, you can move. You can move that purple blade out of there. The little fruit one you can do. Yeah. Get that machine in. Perfect. Now you can grab that Elon Pro. You can prime it. And then you can start getting ready to fold your leaves. You don't have it yet, you can let the nurse know when you use it. But you can put two small lines within. Point it the other way so it's pointing downwards. Because you want to line up the trap. Turn your... No.
Okay.
Go back to turn that nickel pointing down. Yeah. You want to fill the trap of it. That's a small point. Perfect, now get something on the other side. That's excellent. Now put it right next to that. Perfect. You can put that face down. Get your inserter ready. Fold them back to the third side of it. Perfect. You're set to do it. Okay, so we know he's going to need the...
Debbie can open the lens, so
Debbie, can we get the lens for you?
yeah.
Yeah, she told us after they finished. I never did say they were doing both and then there's nothing to ask, so I knew they had a
So the way it comes out is the way it's going to go in. Now that you've everything pointed towards me, point everything towards me. Perfect, now you're going to need to force it to do that. Put it in right like that. So you want to grab just a little tail. I'll put in space in between, yeah? And then slowly push it into the trap. Trick is never to touch the lens. Okay? So just slide in. Keep pushing it forward. I like to turn the force to the other side. And want the tail to go right in there a little bit. Okay, perfect. Great, now put both ends up. So don't pull it all the way. Now grab that one tail and put it under the one that you're closest to your thumb. You can use the forceps and pinch it into the down. And that's your right. Yeah. Really? Don't do any more. And we'll get back in to do right before you and then show you again how to do it, okay? Just snap that thing back there. EFX 3.7. You can change it to IA. Just careful as elbow, okay? So then you're going to get him to fold the lens, okay? So you're going to give him that forceps. You're going to get him the tray to down. Make sure that thing is secured in the tray. Push down on it. And then give him the forceps.
Okay.
It's just not secured in there.
Okay.
I
Okay.
don't wanna.
Okay.
So watch him on the camera on how he does it, okay?
Okay. It's flipped. It's flipped.
Yeah, it's in the
It
trap.
says flipped. No, it's
Well,
flipped.
flipped.
I thought it looked weird when I tried to close it.
Yeah.
You get under those two lips, and then you're going to grab that little tail, and you can close it in after you
Uh-huh.
okay? And you can grab that, stick it in there.
Oh, I see.
Just right under there. Taking the inserter.
Okay. Chopper.
You can get rid of those little forceps and kind of get rid of them. Okay? You can get rid of that. You can move the gently
Chopper.
that one. Move the gently button over the way.
The who?
The blue. Yeah, put the blue there. Okay, if you have that healing on, you need it just there. Okay, then you're gonna need. Bring the blue one up, yeah? Just not use the J one yet.
That's there. And so let's remove the Malyugin. This one. Sub-incisional.
And you can get rid of that insert. So you can get rid of that orange one and bend it out. I'll put it short so it goes like this.
You can see the
Get rid of
iris.
these surgery. Take it out. And you just unscrew that. Unscrew it. No, do that. Yeah, unscrew. There you go. Okay, there we go. Put that nicely in there. Put the antibiotic up there and then round that up. And go to the J one. The one with a little bead, you can use that one. Not that one, you can place that one away. That's it. And we're done. We're gonna go to lunch after this.
You survived the day.
You got a full day next week.
Yeah.
Right, I know. Bye. Grab one. I'll put it up. Sounds good?
That was perfect.
Okay.
Thank you guys for the good day.
Thank you.
Welcome.
Hopefully you have a great recovery.
Thank you very much.
However much time you allow yourself.